Hello there, my name is Corey Durbin, CEO of Shared Health Alliance, and I'd like to welcome you to Running Eyes, a podcast where we take a meaningful, deep dive into the relationships, strategies, and global mission of ASH to change healthcare and change lives. I am here with my very good friend Adelle Brown from the U.S. Virgin Islands down in St. Thomas. Adelle, great to be with you this morning, or actually your time this afternoon. How are you?
Doing great, doing great. Thank you so much, Corey. I'm excited to do this podcast with you.
Hey, I really appreciate you taking the time, and this is our second try, right? So I was down in the Virgin Islands with my family over the Christmas holiday, and we tried to do this my last day there, and we got a great recording.
Yeah.
And figured out the audio wasn't right, it wasn't quite loud enough, eh? So we're back at it.
Yes, without the video this time.
Yeah, and I'm
Unfortunately,
in
but
quite
that's
a bit
okay.
colder weather today, so you might enjoy a break from it, but I kind of miss the warm weather.
All
Well, we're
right.
so grateful to you and for your involvement in Alliance for Shared Health, and I'm excited for our listeners and for the members of ASH to get to know you a bit better. Wow, I think we've known each other a little over 4 years now, and we started
Mhm.
out taking a peek at some of the issues that were going on in the Virgin Islands when I had reached out to you about what's going on with healthcare. And I don't know, how's the situation down there after all the hurricanes and now COVID, and any new news to report relative to what kind of access is going on in the VI with healthcare?
It's the same. It's the same. We people are resilient. It's in the nature. It's in our DNA, and so we make do with what we have. But what we have is not great. I'll give you an example. Right after the hurricane, we have the patients, dialysis patients. They had to send them off island for treatment, and some of them never came back, or most of them, it seemed, didn't come back. And at that point, it was just moving people around to get the care that was needed. And so no one considered insurance was not an issue at that point, but it always comes back to haunt you. So all of this care, who's paying for this? And you can't even get a single policy here, a policy for a single person here in the Virgin Islands, which is unheard of.
Hmm.
And this is why my connection with you has been so important, because I believe that it's a game changer. It makes healthcare available to any and everybody who wants it and who needs it. Not only the fact that ASH gives we can health share with anybody, doesn't matter how many, not the numbers, age, it doesn't matter, but also to the cost. It's better, and you get this. You can compare it to insurance.
Yeah.
The cost is less, and you get the same care, and we share. One of the things that I love is the fact that because of the people that's involved in healthcare and health sharing, we also care about each other's health, and
Yeah.
I love that. Somebody in the United States and maybe in another part, Missouri or wherever, might have a challenge, and if I hear about it, because we're sharing, you can pray. We can hold up each other, because times are difficult, times are tough. Our God has made tough people, but we need each other. The gospel is relational, and so we're able to support. There's that supportive part that you can get out of the health sharing that you don't get in insurance.
Yeah, and I think that's one of the things that when we began to talk about the formation of the nonprofit and the 501c3, that was, I guess, appealing, because our family had been coming down to the USVI at that time for close to 15, 16 years, and it felt like a home to us, and the people felt like family. And so now what Mike Hinchis and you as one of the board members have put together with ASH and making it available, we're excited about that. And so as far as kind of jumping into you've been in the VI your whole life, right? Or you actually maybe spent some time away going to college, if I recall?
Correct. Yes, my higher education was in the United States, and graduated from Creighton University in Omaha, Nebraska. Then I went to Bible school in Oklahoma, and came back home. I felt led to come back home and just come, just roll up my sleeves and get involved in the Virgin Islands and the people of the Virgin Islands. And our ministry, we have a church, but also it's a ministry, which means that we meet the needs. We help meet the needs of the people, the needs that we can meet. And meeting you, Corey, it was like another opportunity to meet another need. And for me, that was a tremendous blessing because I believe in health, in us taking care of our bodies, but I also believe in healing because of what I've been through, but also to health care, maintaining, getting good health care, health services, that's important. And so me connecting with you, it's another avenue of the ministry helping to meet people's needs, introducing to something that they don't have that can actually extend their lives, make living enjoyable.
Well, and isn't that such a big part of it? Because if we just tell people about God and the importance of having a relationship with God and with Jesus Christ, it becomes just noise to some people if their physical needs aren't being met. And so I think ASH has become a critical part of that. Like, let's help people meet their physical needs and their families' needs from a healthcare standpoint.
Yes.
And then, they can say, hey, that there's something different about that organization. And you referenced some of your own challenges. You want to share a little bit about that situation?
Well, I put it this way: I wasn't born to live. From the time I was born, I was always sick. Between clinics, hospitals, overnight in hospitals, that was my life. And I made Jesus Lord of my life at a young age, at the age of around 13. Did my first missionary trip probably around the age of 14, 15. Graduated, went to college, went to Bible school. And I knew that healing was all a part of the cross. And but I never grasped the significance and how to capture it in my body. And I have to say this: thank God for, first of all, medical science. Thank God for insurance, and thank God especially for ASH, because ASH comes to a place where it meets people's needs where health insurance can't, because it's so expensive. Basically, having gone through the clinics, the hospitals, I just got on our honeymoon, Adelle and I, on our honeymoon, I was having surgery. We didn't really have a honeymoon unless you want to consider being in a hospital a honeymoon.
No.
but I learned, and so I'm able, and I'm blessed in that I'm able to connect people with health care, and I'm also able to connect people with the healing power of God, healing through faith, healing through medicine. I have no problems with both. They both work, but I love faith in God. But here again, I go back. I love ASH because ASH, it really, if anyone listening to this podcast would grab hold of this, ASH meets a need that is not, they fit into a position where health insurance is not able to go. And I'll give you an example. Just even the prescriptions, people that use prescriptions for different ailments they have, some of them are so expensive. I didn't realize. Can you believe a prescription could cost $10,000? I have never heard such a thing in my life.
Yeah, we see it all the time, and it's one of those things that we have the Sharks program as a vendor program to support ASH, because it helps our members get access to these high-cost meds, the Victozas and Humalogs, which for diabetics, or high-cost specialty medications. And we've seen drugs filled like Strensiq that are over $1 million a year that our members get for free. So it's a drastic thing, and it's the great part about that Sharks relationship is it doesn't create stress on the ASH Needs Fund, because these drugs don't end up costing the program anything. So really important part, and a lot of health shares don't have access to that, to high cost meds. So it becomes a hole in some of the other programs. And you referenced uh, some of
Mhm.
the missions work that you had went on your first mission trip when you were 14. I love hearing the story of your mission trip to Africa. I know we, Alliance for Shared Health members have a conjoinment to BAIC, as you know, over in
Mhm.
Ethiopia
Yeah.
through our predecessor relationship. And you've got a pretty close relationship with some pastors over
Yeah.
in
Yeah.
Africa, if I recall. And
Yeah.
that story,
Yeah.
I always talk about the story of our board going over there. You weren't able to join us on that trip. It was so impactful for me and to me. And it's one of the things that I believe really continues to impact the work we do. It drives us when we have tough days and these kind of things.
Mhm.
What about that trip that you took? It left such an imprint on you and has made a
Yeah.
difference in the work
Yeah.
that you do every
Yeah.
day.
Yeah. First of all, I want to say it's amazing that Ash is able to to support that missions in Ethiopia. Because tell me, it's a hospital.
Yeah, so
What? Yeah.
the members of ASH have pay a small conjoinment fee to connect to BAIC, and one of the things that has happened is for every dollar that's sent, it's like sending 33 US dollars over
Yes.
there. And a pediatric hospital has been opened. It's the first one in all of Ethiopia. It's
Wow.
right now there's 60 beds. They're going to open another 40 beds in the next 8 months here. It's fantastic, and then
Yeah.
just
It's
we
amazing.
really see lives saved. It's
Yeah.
absolutely amazing.
Yeah, it really is. And that makes me feel good. Um, and I know it makes the people in Ash feel really good that yes, my health care, my health is being taken care of through Ash being a part of this body, this membership. And at the same time, I'm able to be a blessing to people in another country and a
Mm,
tremendous blessing. And this is the power of it. God sees this, God honors it, and God will help every single person that's involved in Ash. He's going to help them because he tells us this is our mission. This is it, helping the poor, helping those who can't help themselves. And we're talking about children. I mean, children. I mean, my heart just goes out to that. I just love that
right.
so much.
So you
Um,
had this trip to Africa. What year was that? I think the story
oh,
you started to reference at one
mm,
point that I just shake
mm.
my head in amazement at the story.
Well, it was 2000. I don't even remember the exact year. But we were invited to minister in Kenya, and we met our host, and they took us into the interior. Now, for many people, and like myself, I didn't understand. I did not know what the interior meant. The interior is a place where you go where no one wants to go, which is where there's no electricity, no running water. But we went, and we went ignorantly in that I love missions, but I always used to tell God, okay, God, I'll go anywhere in the world for you. Anywhere you send me to go, just make sure that that I'm staying in a hotel, like a 5-star hotel, and I have all the things that I'm accustomed to. Well, we went to the interior. So it was quite interesting. No
It wasn't a five-star
electricity.
hotel, was there?
Far from it. As a matter of fact, just to give you an idea, where we stayed in the interior, far in the interior, there was they call it a hotel, but it wouldn't be a hotel. But anyway, the room that we stayed in, it had a bathroom, praise the Lord. But the pipes, the walls to the bathroom, they were open. There were holes, big holes where the pipes run, and there were holes around it. And the thing about it is, malaria is an issue in that part of the world. And so I can see easily how the children get malaria, and how people get malaria because when you build a house, you close it, right? You
Hmm.
haven't,
Hmm.
these houses were not closed. And so you'd want to take a shower. Only one person could be in the bathroom at a time. And when you take a shower, everything got wet. The
Right.
toilet, the thing,
Mm.
just everything. And it was just really horrendous for me. But this is the wonderful thing. I went with sheets, I went with bug spray. I had everything I needed to make me feel like as if I was in a 3-star hotel. So God made a way for me, and we thoroughly enjoyed it. The people were great. The people loved God. One of the things that really was heartbreaking for us was, and this really got my husband moving. And that was, we saw several children that had malaria, and we prayed for some of them, and come to find out one of the little girls didn't make it. The others did, but one little girl didn't.
So
And
sad.
yeah, it really was. And before we left, my husband said, I want to get involved in this. I want to get involved in helping children in these countries. And we looked and we searched for opportunities, but we never really found the opportunity to do it. But here again, now that we're involved in it, we're operating from a different level, from a different perspective now. And so we when we were leaving the interior to go to another city, the children were running behind the car, and what my husband did was he bought lollipops and things like that for them and gave it to them, and they were running behind the car, and it was just so heartrending to see the children, and the water situation was hard. It was just really not a healthy situation. And one pastor told me when we went to another city, he said, it's by the grace of God we're still alive. That's what he told me. Because the water that they wash clothes in is the water that they get to cook with. It's the water they defecate in. It's the same water, same river water. But anyway, we were headed towards the Maasai tribe at a resort to minister to them, and we were in a vehicle, and we were crossing a bridge, and what happened was the bridge was not there. So we proceeded to drive on the rocks, and the rocks got stuck. The truck got stuck from the rocks underneath. So we were stuck in the middle of this river, and there was no water. The water was so low, we could have actually walked over it and really not gotten wet.
Okay.
So we were stuck in the vehicle, waiting for the people from the reserve. If you want to go to see the animals, you go to a reserve. So we were there in the river because the water was low, waiting for the people from the reserve to come. They said they were going to bring a vehicle to pull the truck we were in out of the water. So we're sitting there waiting, and all of a sudden we heard a loud sound, very loud.
That does not sound good.
No. And we turned our head in the direction of where the sound was coming from, and there was a deluge of water coming down, and the water was taller than the vehicle we were in.
Wow.
And what
Was there
happened
a dam there or something like that, or what?
It was water that came from the mountains, in which apparently they told us that they had a hard shower, a hard rain.
Oh, wow.
And so the rain just came down strong. And what it did was it took the vehicle that we were in, it turned it around in circles, and then it stopped, and the water started to rise. And we had with us a couple pastors from Kenya, and in the truck with us were pastors from Kenya, and there was one or two pastors that were from the Maasai tribe, and it was so interesting. So the truck turned around, and it stopped, and the water is now rising, and we're all in the truck sitting down, and the water is rising, and I finally said, and nobody's saying anything. So I finally said, we've got to get out of this truck before we drown. And for me, I'm thinking, well, they should know this. This is their
women's
home.
Intuition, right?
Yeah, but this is their home. They should know this. But anyway, so my husband had a difficult time getting out of the truck, but he finally got out. And then he came around on the other side to take me out. And I told him I wasn't going out. He needed to first take our bag that had our passports to shore. Now we had cameras. We had taken a camera, an expensive camera. We had our clothes. Because we were moving from one location, different parts of Kenya to minister the word. And so I told him I wasn't getting out until he took to shore our bag. Because
now, Adelle, you know that if you're on a plane and they tell you if it goes down to leave your baggage behind, right? I don't know that you would follow that rule. Keep going.
A plane might be a little bit different, but anyway, so
Maybe so, yeah.
he did that, and it's getting dusk, and so he did that, and then he came back for me, and I couldn't get out the window. We couldn't get the door open,
Mm,
and so
mm.
finally, after him pulling and me pushing and kicking, and opening up the window, which brought in more water faster. He took me out, and he took me to shore, and then he went back out looking for our host. And so where he's calling out, we're calling out for the host. Come to find out, she was on the roof of the car, and
Mm.
the other pastors, they had already gotten to shore. So anyway, he helped her get to shore. So we're there on the shore now. We're wet, we're cold, and they're trying to take out SIM card to put in another one for the country they're in, so they could call the reserve, because the other person that had the phone, his phone died. And so while they're doing that, trying to get the phone working to call the hotel, the reserve thing, the reserve. It's getting dark, and when it gets dark, I started to see eyes looking around at us. And of course, I wasn't too thrilled about that. What are those eyes? What are those eyes looking at me? And
Oh,
so
wow.
finally I said, listen, we need to make a fire. We need to build a fire. And so they got wood, and they built a fire. Now, this is what's so interesting. When they got the SIM card and they called the reserve, they said they called the rangers, and the rangers said they would come and get us.
Mm-hmm, mm-hmm.
And so what happened was the rangers came, they got us, and they took us up to where they were, and they fed us, and gave us blankets and stuff because we were wet. And so they told us to wait a couple hours because the water would reside, and then we could go down and get our stuff, retrieve our clothes and different things. And so we ate, they fed us, we ate, and then we went down a couple hours later, and the water did reside, almost like the way it was when we got stuck there.
Wow.
So what happened was, I wanted to get the camera, because the camera was it was like a $9,000 camera. And so I asked the ranger to go out to the van, the truck we were in, and bring the camera, take the camera out of the truck so we could try and preserve it, save it if at all possible. And the ranger told me no. So I said, well, it's not, there's not a lot of water there. You can walk, you can actually walk. You don't have to swim. We had to swim. My husband had to swim to get me on shore. He had to swim to get to shore. I mean, everybody had to swim. The water is down. Please go and get the camera. And he said, no. I said, well, why not? He said, in the water, there are crocodiles.
Oh.
That was a shocker for us.
This was new news for Audain, I would assume.
Yes.
Oh, boy.
And then where we built the fire, where the men built the fire, was where every night elephants cross in that area looking for food. So we could have been trampled on, we could have been killed by crocodiles, and whatever those eyes were, only God knows.
Right.
So they took us back up to the reserve, and our hostess, she is from Tanzania, so they speak the same language as they do in Kenya. And so when we were stuck in the on land, and he saw the eyes, he called the reserve, not the rangers. He called the reserve and told them, spoke something very fast and rapid, like as if he was, scared or excited or whatever, in Swahili. Okay. And he spoke to them in Swahili very fast. And so the host is watching him because she understands Swahili. She didn't tell us what he said. But when we went back up to the reserve the second time, after we had gotten our stuff, she asked him, well, what was all of that about? And because this is what happens when to become a man, you have to kill a lion. You have to do something major. And the guy told us, the Maasai told us that you kill a lion. That's when you become a man. And
That's what
so
I had to do. Yeah.
so when we saw the eyes, apparently he told the people at the reserve, and this is how she said to us. She said, "Hurry, come, come, come! The lions are coming. They're there. I see them. We see them." And she looks at him really with her eyes. I would not have liked to have been him, because apparently what happened was in the truck, when he was speaking to us, what he was telling us, oh yeah, I mean, when the lions see us, they're afraid. They become afraid and they run. But now the story has changed. They're coming after us. They're going to kill us. They're going to attack us. Totally different. So it was quite an experience to see and to hear what was going on. But this is what was so funny was when after I would minister the word, the same guy, the same Maasai guy, he would then go back and preach the same thing to the people. Because he was so excited. It was a fresh word for them
Right.
from the Lord. They were able to breathe. They were encouraged. They were built up. But I mean, it was so interesting that in the truck he was bragging about how the lions are afraid of them when they see him, when they see them, and then when this incident happens, he's all afraid and afraid that they're coming to kill and to eat. Thank God we didn't know that.
Well, it sounds like you had your crossing the Red Sea experience and your being delivered from the lion's den experience all in the same day. So that's you check those two things off the box at once, right?
Yeah, but God
But
is
it's
God is God is good. I mean, He's good. When you're on the mission, and Ash is a mission. When you're on the mission, He provides. He takes
right.
care of you. He protects you, and that's the wonderful thing. That's what I love about serving God.
And I love hearing that. I think the thing that we want to convey as much as possible, I know Mike Hinch just harps on this, and is yes, members of ASH get their own medical needs shared and they get to help others share in their needs. And the goal is for this to be, and it is, an international mission where we're all connected to something much bigger than
Bigger.
ourselves.
Yeah.
And so and that's part of what reaching out into the USVI is all about, and providing a health share solution that is, really starts to open up some ways for residents in the VI to have access to care that they just frankly have limited options, right?
Right. Yeah, very limited. Very limited.
So
As a matter of fact, when you first came down, if they had listened to you about telemedicine when the pandemic hit, things would have been a lot better. But people are hard-headed,
right.
especially when you're politically motivated.
Well, and thankfully now the doors have been opened there, and we've got
Yeah.
the virtual primary care solution and telemedicine solutions are opened up, and
Yeah.
it's such though the lack of availability to those things is also one of the things that really drives up the cost of healthcare, and you get a small number of doctors that I think they do want to help people, but they also start to realize they're the only game in town. And so you in order to control prices and help things be more affordable, you need more supply,
Yeah.
right? And that's
Yes.
what one of the things that ASH provides, even though it's not insurance, is a way to increase the supply.
And my thing is that it's less expensive. I mean, when you look at the cost of insurance down here, and Corey, you've been coming here 14, 15 years, so you know the cost of living here is very high.
Hmm.
So put into consideration the cost of insurance too, that people are, I mean, I think the VI is probably, at least I would say, maybe about 50% of the VI is considered at the poverty level, statistically based on the US Census and things like that. It's expensive to live here, and insurance is expensive.
Well, and going through two hurricanes and now COVID, and no cruise ships coming in, and a lot less tourist activity, although certainly very busy when we were there, which was nice to
Right.
see
Yes.
a couple weeks ago. It cannot have helped the current situation. So availability of programs like ASH, I think, are critical, and it's critical all over. It's critical over the United States in every state, and certainly equally critical in the USVI too.
Amen. That's so true. I just love the concept of ash. I really do. Like you said, ash is bigger than us and it connects us. It's a connecting ministry as well. I mean, who would have ever thought Ethiopia? And there are other places too. I'm sure that eventually doors will open in other places too, where we'd be able to be a blessing to other places. And here again, all of that comes from all of us working together. That comes from all of us sharing our health cost.
Yeah, that's certainly the larger vision, I think, is Ethiopia just a starting point
Mhm.
for the international expansion of helping people access care all over that haven't had access. And, I know Mike speaks so highly of your participation on the board, and you're such a prayer warrior. And ASH does face constant scrutiny. So do other health shares regarding regulatory issues, and insurance companies don't like health shares, and
Right. Yeah.
DOIs don't really like health shares because they don't get premium taxes from health shares. And so we need more options. And having folks like you on the board who understand what ASH is trying to accomplish both internationally and at the local levels with the care and just praying things out. It continues to be so important as ASH continues
Yeah.
to push through obstacles and leap over obstacles. So
Yeah.
thank you for what you're doing there.
Yeah. And these small obstacles are the doorway for the greater, to be a greater blessing.
Hmm.
We will get through them. God is with us.
Yeah,
And
amen to that. Well, thank you, Adele. It's so great to visit with you. Let's do this again sometime.
oh, definitely, definitely. Thank you so much, Corey, for inviting me.
Thanks, Adele. Talk to you soon. Have a
Okay,
great
great.
afternoon.
Thanks. You too, Corey. God
Bye
bless
bye.
you. Bye.
I have two daughters, and I was fortunate with our family to be able to go down to the U.S. Virgin Islands for the first, till they were about in 4th or 5th grade. My daughters were homeschooled, and we got to know so many people as we went down to the Virgin Islands in January, usually the first 2 or 3 weeks of that year, and I would work remotely. We had some friends that owned a house, and we were able to stay there very inexpensively, and it's kind of become a second home to us. We don't have a home there, but I had the good fortune of getting to know Adelle Brown, and it's been such a privilege. She has a passion for the residents and for what is her family in the Virgin Islands. And she wants to see ASH have a significant impact in the USVI. Access to healthcare is so challenging down there. If you don't work for the government, there really isn't a lot of there aren't a lot of options for you. And so it's a privilege to spend time with her. She is a woman who is full of faith. She's been through a whole lot in her life, and she's kind of seen it all. And so having her on the board of Alliance for Shared Health, you all have heard me talk to Mike Hinchis before. He just loves having Adele on that team. She brings a really fresh perspective, and she comes with a really faith-filled perspective where she believes that ASH is going to have that long-term impact that it's supposed to have and continue to grow. And it takes people like that with a passion on the ASH board to do what ASH is called to do every day. And I enjoyed getting to talk to her, and I'm hopeful that we'll have her on again real soon.